My name is Rachel Cady, and I'm an obstetrician gynecologist. I work at Cuyuna Regional Medical Center in Crosby. I've been practicing since residency about 14 years here in Crosby, Minnesota. So hysterectomy is one of the most common surgeries performed nationwide. It's removal of the uterus and usually the cervix, oftentimes the fallopian tubes, and on occasion also the ovaries. But hysterectomy in and of itself means removal of the uterus. This can be done usually laparoscopically, meaning through small incisions, or vaginally, so what we call minimally invasive surgery. It's fairly rare to have to do an open incision given our new technologies for hysterectomy. The more common indications for proceeding with a hysterectomy would be for things like fibroids. These are usually benign tumors within the uterus that have gotten bigger and can oftentimes cause pain or heavy bleeding. Other indications for hysterectomy is for things like endometriosis, which is the lining of the uterus found outside of the uterus and causes a lot of inflammation and chronic pelvic pain. And for women that have tried other management options and are not getting relief and typically long-term pain issues, for endometriosis, hysterectomy sometimes is indicated. Other indications for hysterectomy would be, on occasion, issues related to prolapse, issues related to prolonged bleeding, concerns not managed well with medical management, or other less invasive surgeries. And certainly, uterine cancer, precancer, other indications for hysterectomy. Given that most hysterectomies now, vast majority are minimally invasive, most of the time it's a one-night stay in the hospital, what we call 23-hour observation. And restrictions are usually no lifting greater than 20 pounds for about 6 weeks and nothing vaginally for about 6 weeks. Pain is varied, patient to patient, but overall pain control is usually not that big of a issue for patients because it is through such smaller incisions, which allows for a lot more rapid healing time. And so most patients do need some pain management with medications like ibuprofen, Tylenol, small number of narcotics, possibly for about the first week or so. But as far as time off work, again, varies per patient. For some people, it's maybe even a little less than a week. And for others, they take 2 to 3 weeks, primarily just for getting their energy back up to speed. For women who are having a hysterectomy for fibroids, yes, those symptoms disappear. And in the vast majority of cases for women having a hysterectomy for issues related to pain, particularly endometriosis, we know that the majority of those women will get really good long-term relief from their pain symptoms. A lot of women will ask if hysterectomy means that there's a change in their hormones. And if you're just removing the uterus and or cervix and or fallopian tubes, that does not change your hormone levels. If somebody's having their ovaries removed, then yes, that does change your hormone levels. And that's something called surgical menopause, when both ovaries have been removed. We try to avoid that in younger women, particularly premenopausal women, but that would be what would cause change in hormone levels. Also, a lot of women do worry about hysterectomy changing libido, sex drive, that kind of thing. And there's not really a lot of good evidence-based medicine to support that. Also, people worry about hysterectomy making them more predisposed to prolapse, where things start to fall in the vaginal area. And again, that really is patient specific, and there's not a lot of data to support that either. So a patient can either self-refer, just calling our office. We have our own scheduler here at CRMC, or through their primary care clinician. They can make a consult, and we'd be happy to see them.